was speaking to a surgeon at Stanford, and he was saying, Luke, I'm 71 today. When I was 30, I looked at a symptom, a heart, and I said, I have a great job and great money coming into my bank account. He said, at 60, I realized every body I open up, I'm just hit with the intelligence of a human being that is crumbling under suffering, anxiety, anger, disconnect, and all of that stuff.
The very first thing, Luke, when someone comes to me with a heart problem, and often they've had a heart attack, and often that heart attack has caused damage to the pump, so the heart is weak and they have congestive heart failure where fluid keeps backing up into the lungs. The very first thing, and this is always the case, that I would bring to these people is empathy and compassion. Empathy and compassion. Because it's so easy when someone comes into the clinic or the hospital, the doctor's very busy, the hospital needs to make money, and thank goodness we're born in this century when we have so many medicines and surgeries, and yet at the same time, we're missing a deep empathy and compassion for these patients who are stuck in a system that doesn't seem to care. And I'm not just saying this because it feels good for heart patients to be listened to by their doctor. I'm saying this because there is a literal physiologic change in the heart of someone who's had a heart attack when they feel loved and supported by the doctor, the nurse, the pharmacist, the husband, the wife, the child. This is not some ancient, mystical, spiritual mumbo jumbo. The science points to the fact that empathy and compassion and love are the most powerful drug for healing our hearts. And then after we spend a lot of time on bringing love into our lives, love and compassion for ourselves, even in the face of all of our suffering, then we can talk about exercise and nutrition